Hello guys, it's Mungai Eve. Welcome to the Mungai Eve show. And of course, we're the #1 online TV show. And guys, we're right here at Komarock Modern. We all know tumekuwa na event kubwa sana hapa ya watoto. And guess what guys, nimepata opportunity ya kupatana na Dr Nyamu mwenyewe. Tupige conversation atuambie Komarock Modern ilitoka wapi. Unajua kila mtu anasikianga Komarock Modern, but hatujaijua ilitoka wapi, ilianzaje na wamefikisha wapi. Anyway, Doc, uko aje?
Niko sawa, nashukuru.
Umezoea hii mambo yetu ya kamera?
Siku hizi nimezoea kwa sababu saa nyingine unapatikana off guard.
Wanakuambia tuambie kitu.
Na lazima niseme kitu.
Exactly. Anyway, Doc, ebu tell us more about Komarock Modern. Ilianza wapi?
Komarock Modern Healthcare started the year 2004 at Komarock Estate. Currently, of course, we have 4 branches, but the beginning of it basically was, I started in a chemist, behind the chemist. A chemist that time called Destina. There was, a lecturer called Dr Ngomu and a pharmacy called Destina. And when I was actually doing my internship in Kenyatta, he requested me to come and, work in his dispensing room. And that way I developed my clientele. Because I would come from Kenyatta around 6 or 5, start seeing patients up to around 9. And basically what I would do is just do the prescription, and patients would buy medications in the pharmacy. There was a gentleman called Ibrahim also who had a lab there, and he would, when I want my patients to do lab work, they would do with in that lab. Basically, the room was quite small. Actually, you would not be able to, the doctor would not be able to go out of the room if the patient is sitting. So I undersit that and to fold, so that, I tell the patient to stand up a little bit. I fold the seat, then I'm able to go out if the patient is still there. So after that, I started building the clientele. It reached a point where the pharmacy was difficult to be closed, because then I had to be there sometimes up to around 1 a.m. That of course would be a bit difficult, because the pharmacy needed to be closed because I was operating the whole day. I one day found a Somali gentleman who had an injury of the forearm, and decided to wait for me from around midday up to around 7 in the evening for me to do the stitching. And I felt that might cause another issue, and requested, I got a nurse called Chris to come and be there in case there's something like undressing that required to be done, or some injections. That was my first staff. After that, of course, my clientele then grew. There's a huge Somali community in Komarock, and of course Sudanese and other people. And I felt that I needed a better space. So I got a space just next, which had 9 beds and 2 maternity beds. Both antenatal and postnatal. Where I stayed for around 2 years, and decided again the hospital was full most of the time. It was difficult for me to work elsewhere and to rush to come and attend patients. That way I actually got a friend of mine who had a house. Actually, he was not selling. I had to request him to sell the house to me, where the current Komarock Modern Healthcare sits in Komarock. And I built the current Komarock Modern, which has around 24 beds, is a level 4 facility, with theater, X-ray, ultrasounds, and maternity unit. And of course, after that, again, the need for more space, because the current Komarock Modern Healthcare in Komarock branch is also full most of the time to the brim, and they wanted an overflow. And I had to look for an area where I can get enough land to buy, and then go to Tawala, so that then I would now build an hospital that fits the need of the environment. So I moved to buy a piece of land in Tawala in the year 2000, and that's around 7 years ago. Built the current Komarock Modern Healthcare, which is a level 5 facility with theaters, an ICU, HDU, and of course the most important thing to me, the maternity unit. Now that actually works as an overflow when we have the Komarock Modern healthcare branch in Komarock being full, then we have to refer patient to Utawala because, of course, it has more space. Of course, the current hospital also is full most of the time, and we're also trying to expand more. We just built a new wing for the private maternity wing, and we are also in the process of doing a cancer center and also a college for nurses. So that's how it started.
You've stated that there are other two more branches. People would love to know, where are they located?
The other two branches are located in the Rakanith branch, one in the Rakanith county headquarters, a place called Kadhwana, and the other one in the main town in the Rakanith called Chuka. The first branch in the Rakanith, which is in Kadhwana, basically to me was a CSR. I was trying to give back to the community. That is where I come from. Brought up in a very poor environment, and I know people there are yearning to go to hospitals where they can get the same care. And that way, my purpose of doing the facility basically was actually giving back to the community and telling God thanks for what He has done to me, and take care of God's people. And it is doing a good job in terms of taking care of the people there, not in terms of making money, because that was not my intention. My intention there was not to make money, it's basically to have people get the services in the next door. Yeah.
Okay, you've stated that you have a plan of coming up with a cancer center, and you all know, like, cancer stuffs like what are they called? The machines that I use, they are very, very expensive. I would like to know, why is it that you felt like a cancer center is something that you'd like to go for?
Well, the current states, life is changing. People have, when you look at the level of infection in terms of cancer, actually currently Meru region is leading with cancer in Kenya. And I have people even around me who have cancer and struggling to find out help. And sometimes they get diagnosis very late. And that way, I also want to avoid people being referred to other places and, of course, lost to follow-up. And, of course, cancer treatment is very expensive. My intention is to have a cancer center which, again, would be able to offer that care that is offered in other hospitals, but at an affordable price. Yeah.
Okay. Within the 4 branches that you have, most of us, the one that we've been able to see, especially online, it's the Utawala branch. Why is it that hizi zingine hatujakuwa tukiziona pale kwa mtandao?
Well, ukienda kwa mtandao hizo zote ziko. Just that, of course, then the main place where we have the main offices in the Utawala branch. And of course, Utawala is a reflection of what is happening in other branches. But otherwise, they are there, and we have end events many other times in those specific branches. And like the event we end today, we'll still do another one in the Rakanith County.
Yeah. Today was Fans Kids Day Out. Komarock babies wenye wamezaliwa hapa leo ilikuwa siku yao ya kujibamba. It's something that I've never seen with other hospitals. I would like to know, where did this idea came from that we felt like it's good, the Komarock babies, they get to meet and enjoy together?
Well, this has been my plan even before COVID. Actually, it's COVID that disrupted the plan. Apart from the Kings meeting, I also wanted to meet the Kings. I wanted to meet the Kings and have that fulfillment, seeing children whom I have helped deliver when they were, like a minute old, up to now when you have those who are 15, 16 years old. To me, that is the fulfillment I wanted to get, which I've already gotten. And of course, have people feel that they are part of the Komarock modern healthcare family. Again, people sharing together, like we have shared a cake and other things. Again, that to me is a blessing by itself. And I have seen, and I actually didn't think I have helped deliver that number of children and that way that encourages me to continue doing that every other time. Yeah.
How often are we going to be having such events?
We'll be doing it every year once. Of course, we have several other events. We and the baby, I mean the baby shower for the ladies a few months ago, which we'll still again do in a few months. So this event of the Komarock Modern Babies Day Out will be done every year. Yeah.
Okay. We've seen that there are so many celebrities who are present at this particular event, and they are, most of them, they have been able to experience services at Komarock Modern. First of all, I would like to know, why is it that you as doctor at Komarock Modern, you felt like it's good to work with celebrities, and also it's good to focus on digital marketing rather than the traditional marketing that has been there?
Well, most of the celebrities who are brand ambassadors for Komarock have been treated at Komarock Modern Healthcare. And that way, rather than doing a billboard, to me, when these people come and they get the care here, then they give their experience, which is not, it's not a story you are giving. You are giving your experience. And that way, people tend to believe in that story more than just finding a billboard and they do not know what is happening in that hospital. And that approach to me is an honest approach. When people come here, whatever you have told them, whatever they have seen in social media or whatever, when they come here, that is exactly what they find. So I don't want to, cheat people of what is happening, and that way the approach of the people coming here and getting the experience by themselves and telling other people, then to me is more genuine than doing a billboard. And of course, they have followers who will come and find out and then give feedback to the same celebs, and they also give us feedback. And those are the feedbacks that make us grow. Yeah.
There was a time one of the brand ambassador was not feeling well, and unfortunately, I don't know whether you got that story, but it was there online. There was a conversation that was going around that the services that the celebrities get in the hospital, they are different from the ones that mwananchi wa kawaida gets.
Well, I saw that, but I think that's an unfortunate thought. We do not have a room for a celeb and another room for somebody else who is, a common person or who is not a celeb. The same rooms where these celebs are treated is the same place where anybody else, whether they have a cover that is not paying a lot of money or they are paying cash, it is the same place. We do not treat you depending on the type of vehicle you drove to Komarock Modern. We give them the same attention. And of course, what people need to do to prove that, there are people who have been treated here. Possibly they can get an answer from the people who have been treated here who are not celebs. And that way they will actually attest to them that the care they got is exactly what the other people or the celebs are getting. So there's no difference in terms of a celeb delivering or a celeb being treated in terms of any illness like pneumonia or pressure and someone else who is delivering. We give the same attention, yes.
Okay. So in Komarock Modern healthcare, most people tunaijua na maternity, reproductive healthcare. We would like to know other services zinapatikana hapa.
Well, of course, that's the backbone of the facility. The reason being, I'm the CEO of the facility or the team leader, and that's my specialty, and that is why it shouts more than others. But we have all the other services. We have the usual outpatient facilities. We have lab facilities. We have we admit patients with general conditions, medical conditions. We have ICU, HDU. We have dental facilities. We have dialysis units in most of the branches here and in Tharaka-Nithi. Like in Utawala branch, other services apart from maternity, we have dental, HDU, ICU, dialysis, and male-female wards and pediatric ward. Just like we have seen, we have many children. In Tharaka-Nithi, again, we have a level 5 facility, which has other services apart from maternity, HDU, ICU, dialysis, dental facilities, and treating other non-gyno-related cases. Yeah.
Tukimalizia, Doc, I'd like you to talk to people who have experienced healthcare here at Komarock Modern, and also let us know, are you guys planning to have more branches?
We are already constructing more branches. God willing, in a near time, we should commission the Kitengela branch. We are praying for it, and God will give us the material wealth to be able to complete that. We want to give people in that county the services that other people are getting in other counties. We would want to move to other counties like Mombasa, Kiambu. I have many people requesting us to do facilities in Kitui, but currently what we are doing is the Kitengela branch and also restructuring the branch in Chuka to be a level 5 facility, which is able to take care of other more people. Of course, we would want to be careful about opening many branches at the same time, because if we do that, then the care goes down, and we would want to maintain the care. As much as we open more branches, we would want our care to remain the way it has been or better than it has been. Yeah.
Dr. Nyamu, would like to know what keeps you going, what motivates you each and every day to wake up and go help a mom out here deliver a child?
Well, this is what I wanted to do from the time I was a young person. And to me, it is a calling. I do not wake up to come and make money. Of course, you have to have money to move from one point to another. But what keeps me is the fulfillment. When I have ladies who come here with infertility issues, you help them conceive and deliver. That fulfillment keeps me going. Again, you have people who specifically are requesting me to attend to them, even at this level, and they give me feedbacks of how they appreciate whatever I've done to them. That fulfillment is actually what keeps me going. And I have patients who have encouraged me many times, because of the feedback they give me. That feedback is what I thrive in, and I would want to continue doing that. I have no problem when I'm being called at night by anybody, either it is a management issue, whether it is obstetrics and gynecological issue. I have no problem, because to me it's a calling. Yeah.
Since you started your journey in the job that you do, what is the most challenging maybe issue that you've ever encountered?
The most challenging issue currently to me is trying to balance the clinical practice and management. I sometimes work for like 14 hours in a day, and for those 14 hours, or say 12 hours, because sometimes, like yesterday, I actually worked from 5 a.m. to around midnight. And now, the challenge is you have people requesting that they want you to attend to them specifically, and you also have one or two managerial duties you need to attend to. So that balance has been a challenge. But of course, God has given me the strength to handle that. But since treating patients to me is part of management, because I'm in direct contact with my clients and my patients, they will give me a feedback of their experience here. So in the process of treating them directly, then I tend to do the management better, because I can get the first-hand either complaint or first-hand information from patients who have been treated at Komarock Modern Healthcare. Yeah.
Thank you so much, Doctor. We really appreciate for your time. It has been the Mungai Eve Show. In case you're watching this video and you haven't subscribed to my YouTube channel, subscribe. We meet in the next video.